Howdy y'all, Dr. Islam here. If you've been diagnosed with Crohn's disease and are you frustrated with the treatment plan that you're getting, in today's video, I'll give you 5 revolutionary new options that are coming out when it comes to treating Crohn's disease. If you're suffering from this debilitating condition, this video is for you. Guys, let's talk about food. Howdy y'all, I'm Dr. Islam. I'm a board certified gastroenterologist trained at the Mayo Clinic. I've over 10 years of treating all sorts of patients with IBD, with Crohn's, and ulcerative colitis. We are experts in this condition. If you haven't already, don't forget to smash that like button, like, share, and subscribe, and come see us at Lubbock Gastro. We can find out what's going on and give you a personalized approach to get your Crohn's disease taken care of. The first class are the IL-23 inhibitors. And on the medications for this include a medication called Skyrizi and also Tremfya. What we think is going on is that IL-23 is an important cytokine that plays a role when it comes to inflammation of your bowels. And by blocking that cytokine, you're actually blocking the inflammatory pathway, which leads to a cascade of inflammation, irritation down the road. And for my patients who we switched them to these medications, they actually have done very, very well when it comes to treating their Crohn's disease. Now, currently the only one we have approved right now is Skyrizi, but I anticipate in the next couple of months, Tremfya will also be approved because studies have shown in both psoriatic arthritis and psoriasis, it actually can decrease inflammation that's going on there as well. There's a common pathway when it comes to inflammatory issues in these diseases. Number 2 are the JAK inhibitors. This includes a medication called Rinvoq, which is currently the only FDA-approved medication in this class. The idea is that the inflammation is driven by what's called a JAK1 response. What these medications do is that they actually inhibit JAK1, thereby decreasing the immune response to the body. The theory behind this is that the body's immune system actually attacks itself to drive the inflammation, irritation that occurs when it comes to Crohn's disease. And by blocking the immune response, you're actually able to reverse that cascade, prevent inflammation from occurring, and calm the bowels down. So in my patients who we switched them to this medication, they actually have done very well in controlling their symptoms and getting themselves feeling better as well. The next one are the S1P receptor modulators. This includes a medication called Zeposia. Now, Zeposia currently it's only approved for ulcerative colitis. Those studies are undergoing for Crohn's disease. I anticipate that change to be happening in the next couple of months. And this medication modulates the S1P receptor. And this is thought to be playing a role when it comes to immune cell trafficking. So we're going more specific into the immune system as they cause for the diseases. And by blocking these particular cells, this prevents the inflammation from occurring and decreases the risk of you causing problems down the road. Next are microbiome-based therapies. I'm sure you've heard stories of fecal transplants being used for different conditions. In fact, fecal transplant is an approved condition for a condition called C. diff. Now, we have studies suggest that Crohn's disease can benefit from a fecal transplant. And there are currently studies undergoing in which you're using this as a way for treatment. Now, currently, it is not FDA approved to treat Crohn's disease. And so if you try to go to a GI doctor and say, hey, I want someone else's stool in my body to change the progress of my disease, they'll be like, heck no, we're not doing that because it's not FDA approved. But we are seeing more and more studies on the benefits of microbiome-based therapy. So I anticipate that in the next couple of years, we're going to get more clarification on whether we should consider this as a root cause for what is going on, but also as a root cause to get your bowels taken care of. Then lastly, stem cell therapy. Stem cell therapy is getting a lot of interest specifically in Crohn's disease because it's such a debilitating autoimmune disease of the gut. And by using stem cell transplants, we have actually seen the benefit of putting your own cells to help control the inflammation going on inside your body. Now, once again, this is not an FDA-approved medication, but early clinical trials are showing promising results, and we're seeing a decrease of inflammation for those individuals who undergo stem cell treatment. So these are some of the newer medications that are coming out when it comes to treating Crohn's disease. So I know for a lot of my patients, having Crohn's disease can be extremely debilitating. And this video is to hopefully give you hope that there are options that are out there and we are undergoing clinical trials to get you taken care of and to get you feeling better. Well, thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you want to learn more about what you can do to help treat Crohn's disease, click on these links down below. I have a lot of playlists on this. And if you want a more personalized approach to get your gut taken care of, come see us up at Gastro. We can find out what's going on and get you all squared away.